Good morning, members. We have a quorum. I call the meeting to order. This is the Bills Committee on Electronic Health Record Sharing System Amendment Bill 2025. Let me remind you that the Health Services panel will take place at 11:15. Most of the members here are members of that panel. I reckon that government representatives will also have to go to that meeting. We need to wrap up this meeting at 10:30 sharp. Please invite the government representatives to come in to join us. Members, the Secretariat has received altogether 18 submissions from the public. The administration has submitted a consolidated written response to these submissions, paper number CB-3676 of 2025-01. When the administration representatives come in, we will ask them to go over the consolidated response. We have only the Chinese version at the moment. The English version will be submitted to members later. We have with us Mr. Sam Ho, Deputy Secretary for Health, Ms. Erica Lam, Principal Assistant Secretary for Health, Mr. Melvin Kan, Assistant Secretary for Health. From the DOJ, we have Mr. Michael Choi and Mr. Anderson Chan. From the Hospital Authority, we have Dr. Joanna Pang and Chief Systems Manager, Mr. Eric Wong. When the government representatives are ready, we will hear from you the consolidated response to the submissions. Good morning. Let me quickly go over the consolidated response. We have received 18 submissions. We've gone through them. We note that there is a general support in principle to the proposal and the objective of eHealth Plus 5-year development plan. It's mentioned in the submissions a number of concerns. The views in the submissions are: first of all, a requirement of a provision of specified information by specified healthcare providers. Some submissions mentioned about in the private sector, there are some healthcare providers without sufficient electronic systems in place to meet the requirements. They ask whether there will be support and guidance from the administration. There are views about data security in relation to eHealth Plus. Some views expressed a question about sufficient support on the eHealth system. On the parts of the general public, they asked about the acceptance of electronic documents, how the government uses information in the system, as well as participation by different parties. We have given a written consolidated reply. In the first two meetings, when we talked about policy issues, we have already covered the points mentioned in the submissions. We respond to these 18 submissions by quoting what we have said before with further illustrations. I do note that most of them are issues covered in the first two meetings. Members, any questions to follow up? If not, we will go on with the clause-by-clause scrutiny. Members, we use the Chinese version. In the last meeting, we were at clause 5. That is section 2 of Cap 625. Last time, members asked which version we use. We have agreed to use the marked up version. The government will also draw attention to the blue bill, but we will mainly use the marked up version. Members, in the last meeting when we were scrutinizing the definition of shareable data, that is, in marked up copy, page 2 of CB bracket 3541 of 2025 bracket 1, some members raised a point. They asked if it is appropriate to not define data and information. Well, there was a discussion last time. In the last meeting, the administration has finished explaining the amended definition of prescribed healthcare provider, that is, page 3 of the marked up copy. Members, any other questions in relation to prescribed healthcare provider? Ms. Carmen Khan? Just for clarification, in relation to data and information, if I remember what happened last time correctly, the decision is not to have a definition yet. We will continue with the scrutiny to see if there is enough clarity in the remaining clauses. We now use the ordinary meaning, the dictionary meaning of the two terms. In this bill, there is no definition of these two terms. We will continue with the scrutiny to see if this approach is appropriate. Your understanding is correct. Let's continue with the clause by clause. It's now page 3. The definition of index data is clause 5 bracket 6 of the blue bill. Administration, please. We will continue with the clause by clause. We will start with clause 5 bracket 6, which is page 3 of the marked up version at the bottom. This is a technical amendment. We will use e-health to system. As a result, we are going to replace system. We are going to replace system with e-health system. You'll find this in page 4 of the English version. Now we will continue with page 3. This is to expand the definition of information. This is to take into account relevant information in relation to instructions in an advanced medical directive of the recipient. We've added B. Any life-sustaining treatment that is not to be provided to the recipient as stated in an instruction in an advanced medical directive of the recipient. Well, if members press the button, it will have 4 minutes question and answers included. We will turn the page now. Page 4. The next one is in relation to registration. Is clause 5 bracket 10. We use e-health system to replace system. Next, 5 bracket 14. The definition of registration. This relates only to the Chinese version. Before the word 政府 government, we add that of the the government of the SAR, 特區政府的. We use this term in the Chinese version. That's why we have made this change. There are similar amendments in some other clauses. Now we continue. 5 bracket 9. The definition of registered healthcare provider. Now with 5 bracket 15. It is also in relation to the Chinese version of registered healthcare provider. Before the word 政府 government, we add SAR, 特區. Now, next is the definition. We also replace system by e-health system. Next is section 6 bracket 16, definition of electronic medical record system. We're going to repeal the definition because it is not mentioned. If not, we will continue with page 5. The first amendment is 5 bracket 3. Healthcare professional. We have expanded the categories of healthcare providers. There are some non-Hong Kong ones, so we would like to expand the definition. We have removed specified person in the schedule. We will add A, a Hong Kong healthcare professional, or B, a non-Hong Kong healthcare professional. Mr. Kenneth Leung, I would like to go back to registration. C, the Chinese version. You have deleted the word government, 政府, and add that of the SAR government, 特區政府的. But when it comes to registered healthcare provider, no. Well, B, government department in the Chinese version. There is no such addition. No addition of the word 特區 SAR. Perhaps we will defer to the DOJ. The word 的 is missing. Well, this Chinese word 的 doesn't have any substantial meaning. It's an issue of style to see if the addition of the word will make the flow better. If we refer to a department of the SAR with the word SAR, 特區, then we add the word 的. Here we only said 部門, department. It is better to go without the word 的. So we will only consider the flow when we make a decision on whether to use the word 的. Reference code. Well, I can't find a definition saying that government means SAR government. 政府 is 特區政府 because it was said. Perhaps I will explain to be supplemented by the DOJ. What I said was that under Cap 1, the word government, the translation is SAR government. we want to achieve consistency. In the Chinese version, we add the word 特區 SAR in before the word government. Thank you.
請阿陳沛良議員。
Mr. Chan Pui-Leung, concerning the healthcare provider, you now have A, Hong Kong and non-Hong Kong categories, healthcare professionals. If there's another addition to the law later, would you have to amend the law then? Well, healthcare professional is a generic term. It would cover both Hong Kong and non-Hong Kong healthcare professional. And we will also provide a definition for Hong Kong healthcare professional. And we would cross-reference to the schedule where you see a schedule of healthcare professionals. And the list of the schedule can be amended through subsidiary legislation. Here, this is just to say that healthcare professional can be Hong Kong and non-Hong Kong healthcare professionals. Ms. Carmen Kan, with regard to the explanation of the meaning of the word in question, I would like to seek some clarification. If under Cap 1, the Interpretation and General Clauses Ordinance already provides a definition that government means SAR government, so why do we need to add the term SAR, or government of SAR, here one by one? And Mr. Chan Pui-Leung also asked a question about healthcare professional. And under 005, it is amended to read A, Hong Kong healthcare professional, and B, non-Hong Kong healthcare professional. If you have a definition for this particular term, please also refer us to the definition, because this is a defined term. If you highlight the definition for this term, we'll be able to understand it better, and perhaps we can ask our DOJ colleague to explain. Thank you, Ms. Khan, for your question. Under Section 3 of the Interpretation and General Clauses Ordinance, the government means 特區政府 in Chinese. So it would be better if we render this term government in Chinese as 特區政府 or government of SAR. So it means that in some laws we do not specifically mention government of SAR when we want to refer to government. So in some laws, it would just be plainly government 1. That's why you have put this term in Cap 1, and you don't need to amend those laws one by one. In Cap 1, Interpretation and General Clauses Ordinance, it specifies that government equals or means government of the SAR. We understand that in some other ordinances and legislation, the Chinese term may still be 政府 or government, and the government is going to move amendments to replace it with government of the SAR or 特區政府. So you want to do this with regard to each and every law. But it will not be done through an amendment bill. So the old term may remain there for many years, because you can, the term 政府 or government can be found in many pieces of legislation. And now maybe you have to introduce a miscellaneous or omnibus bill for miscellaneous amendments. Why don't we just rely on Cap 1? And that is, whenever we see the term in Chinese 政府, it means government of SAR. Oh, that's just a comment. Can we just rely on Cap 1 instead of trying to amend the term in every piece of legislation? Well, that's a question. If we are referring to a foreign government, it will be 外國政府 in Chinese. So we'll seize the first opportunity to move amendments of this term when it's available. Yeah, so please provide a written response to the question of whether we should have this term amended. Well, as for the cross-referencing, well, we are doing that in a sequential pattern. So we will not miss anything as we go along. But when we comes to something that has a definition, we would refer members back to this part of the bill. Healthcare professional? Oh, yes. The definition would cover both Hong Kong and non-Hong Kong healthcare professional. There will be definitions in subsequent clauses. Ms. Doreen Kong. Sorry, I pressed the wrong button. Reverend Peter Douglas Kuhn. Well, I'm not trying to mince words here, but if you talk about a consistency between the two versions, in the English is just government. Why don't you also specify that is the government of the SAR in English, instead of just doing this to the Chinese term? Well, government with capital G is different. It's a simple, more simple approach, because it's a government with a capital G. That means it's not the general term of government. So people can make the distinction. But I do understand Reverend Kuhn's point. Perhaps you can provide a written response to this particular suggestion. Or perhaps we can adopt Ms. Khan's suggestion, which is much more straightforward. Thank you, Chairman. Legal advisor? Some information for members' reference. Under Cap 1, 特區政府 in Chinese is defined as 特區政府 or government of SAR means government of the SAR in Chinese, 特區政府. All right, let's move on. Next amendment on page 5 is clause 5 bracket 5. Definition of healthcare recipient. Under the bill, there will be Hong Kong and non-Hong Kong healthcare professionals. So we have to make a change to the definition of healthcare recipients, meaning that they can be. We need to amend this and cover services. It can be a care given in Hong Kong or elsewhere. Next, 5 bracket 4. Definition of healthcare provider. Since we are going to cover cross-boundary healthcare provider, so we would have to cover the healthcare provider elsewhere in Hong Kong or elsewhere. It's a definition of healthcare provider. Ms. Doreen Kong. I want to revert to service, healthcare service. A, healthcare, the definition of healthcare, the health conditions of or the healthcare provider to be provided to the recipients. My question is the term health defined? Health is a very wide term. People like to get inhale high concentration of oxygen. Is this something that is considered to be beneficial to health? Well, we want to cover all the healthcare as well as all the healthcare services as far as possible, but we have to have regard to the context in defining whether certain healthcare service is defined as healthcare here. But what about my example? It's related to improvement of health. As for the data, healthcare data, and if there's a provider and a recipient, then I would say it's covered by the definition of health here. So we were on healthcare provider. We have another term here, a new definition of certain terms. It's a bracket cross 5 bracket 18 cross. There are two definitions. Fixed penalty, new definition, fixed penalty. And the secretary can ask healthcare provider to provide information to the e-health system. So this is the fixed penalty in relation to enforcement. It means the fixed penalty in Section 2A of Schedule 4. We'll come to that later. There will be opportunities for more detailed discussion. Next is Hong Kong information infrastructure. So recognition can be granted to Hong Kong and non-Hong Kong healthcare infrastructure. So we need to provide information. Non-Hong Kong information infrastructure means information infrastructure operated outside Hong Kong. All right. If there's no question, we can move on to the next page. Page 6. It's also related to cross 5 bracket 18. Some new definitions. First, non-Hong Kong healthcare professional, which we have covered. It means an individual who is licensed or otherwise permitted to provide healthcare in a place outside Hong Kong under the law of that place. Please pause. Dr. David Lam, if it's outside Hong Kong, we cannot rule out that there are people providing healthcare notwithstanding the fact that they don't have a license. What do we do with those unlicensed professionals?
入邊呢，
Dr. Lam, you see that, well, in addition to someone who is licensed or otherwise permitted, there is an addition that is otherwise permitted to provide healthcare in a place outside. We want to make sure that there is a certain level of recognition of someone practicing outside Hong Kong. It would be better if it's someone who is licensed or permitted to provide such service. So is this sufficient just to have the information in brackets? Yes. We'll continue. The next one is non-Hong Kong healthcare provider. Under this bill, there will be the addition of non-Hong Kong healthcare provider. That's why we have this definition. It means a healthcare provider that provides healthcare in a place outside Hong Kong. Ms. Kong, you have a question? Yes. In relation to non-Hong Kong healthcare professional and non-Hong Kong healthcare provider, the current definition is that they are people who provide healthcare service. So if it's someone who provides, in addition to healthcare service, other services, then they are included under the definition. I don't know much about other places. Perhaps in those places, the professional or provider will provide other services in addition to healthcare ones. Will they be included? Such as what service? Geriatric service? Elderly care? Well, time changes. There may be one-stop service provided. So is it broad enough to include all those people? If you're talking about elderly service, then it's already included in the definition of healthcare. So in addition to clinical, there is also care. So other than clinics, hospitals, residential care homes for the elderly can be registered as a healthcare provider. So this is already included. In reply to the member's question, if there are services outside healthcare, will they be included? The operation of the system is to ensure access of relevant information. So the scope is on healthcare service. I wonder if my answer is sufficient for the question. Ms. Khan? I just want to get some clarification of the two definitions. One is non-Hong Kong healthcare professional. The other one is non-Hong Kong healthcare provider. Professionals refer to the individuals. Provider refers to the organization. It's mentioned in the discussion on policy. I hope I will get more information in the relevant definition. Well, there is the word specified and relevant. It should be relevant to the provisions. To follow up on a question by Dr. Lam, it says, licensed or otherwise permitted under professional, whereas for an organization, it only provides healthcare in a place outside Hong Kong. Why isn't it the case that these organizations should be licensed or otherwise permitted to provide such service? Under the current definition, it doesn't refer to someone who is not licensed as well. I thank the member for the question. We want to provide a generic definition in this part. So whether it's provider or non-Hong Kong healthcare provider, we refer to a healthcare provider in Hong Kong and one that is outside Hong Kong. When we recognize Hong Kong healthcare providers and non-Hong Kong healthcare providers, we will make sure that these providers are licensed. In the case of Hong Kong ones, there is a provision that specified what kind of healthcare providers can apply to become a recognized one, maybe under facilities under Cap 633 or licensed premises under relevant elderly residential care service ordinance. For non-Hong Kong ones, there are similar provisions. I will explain later. There are conditions that have to be met before they are recognized. We want to make sure that these non-Hong Kong providers are qualified and recognized ones to provide services. So we handle with it in the process of recognition instead of elaborating on it under definition. This is how I understand it. This is the basic meaning of professional and provider. In the provision that will be specified, recognized, and prescribed. So perhaps you will give us further explanation when we reach those parts. Yes, there are different terms with a different meaning. Specified providers may mean different things under different frameworks because it involves different powers in the use of the system. I will provide further explanation later. Ms. Lam So Wai, thank you. I want to ask about non-Hong Kong healthcare provider. There are service providers that provide services online and some cross-border as well, say clinical psychologists providing online treatment to patients. Would that be a clear definition? There are patients that require different professional services. Some are not face-to-face. They may be teleconsultation or online treatment. Are they included? We understand that there are more and more online services. These services, there will be new ones emerging in the future. They will be covered in the system. But let me add that when it comes to registration, we ask the providers to provide a physical location, address for the registration so that we can easily follow up when something happens. The provision of online service will not exclude these service providers. Let's continue. The next new definition is specified health data. Ms. Kong, you have some questions? In relation to non-Hong Kong healthcare professional, in Chinese it says that licensed and then bracket, otherwise permitted to provide health care. But in English, there is no bracket. Well, in the schedule, it's clearly stated in relation to Hong Kong healthcare professional. How come that the scope is wide in the definition? It's licensed or otherwise permitted. Can you elaborate what is meant by otherwise permitted? is touched on in Dr. Lam's question. In different places, the recognition may be different. It may not necessarily be a license. It may not be called a license, but the provision of service is recognized. Different jurisdictions may have a different approach. That's why we have put in a scope that is wider. In the realm of the e-health system, when it comes to the recognition of a healthcare provider, the government has the duty to make sure that it is provider or professional that is recognized in the place where they are registered. So you are the only gatekeeper. I see from the submissions that they are concerned, the members of the public are concerned about non-Hong Kong providers or professionals. They wonder whether they have to be licensed or not. It's not the case that they don't have to be licensed. It's just otherwise in a different way to obtain a license. So it may not be a license per se. It may not be the exact term license. We don't want to leave any ambiguities or uncertainty. That's why we leave it wider. We are very careful when it comes to non-Hong Kong healthcare professional. In addition to considering whether they provide service in their place, we will consider other factors as well. Say, for example, data security of the system, and whether they are willing to comply with our request, our demand for putting in place measures to ensure security and safety. We are aware of the concern of the public. We will be very careful when it comes to granting a recognition. Please continue. We'll continue. The next is a new definition, specified health data. Similarly, well, the Secretary for Health may require specified data to be put into their account, into user's account. It refers to data specified in section 26Q bracket 3. We will elaborate when we reach section 26Q bracket 3. Specified healthcare provider is relevant to the provision. It's a new definition. It means a healthcare provider described in section 26Q bracket 1. We will give you elaboration when we reach that section. Ms. Carmen Khan. Specified health data. I think it's relevant to whether there needs to be a definition of data. You will give a definition in section 26Q bracket 3. That's why there is no definition in this part. You have to refer to the relevant provision. Well, you are the person who drafted the bill, so you know everything very well, much better than we do. So you need to explain to us why there is no need to have a specific definition. When we reach that part, will you explain to us why you define data in such a way? Because the entire bill is about data and information. We need to understand why there is no need to have a general definition here. And we'll have to go to the specific provision to know the definition. And the fact that this, you suggest, is a better approach. We have to then go to Schedule 3. So we have to look at data in different parts. we might have forgotten about it when we get there.
時候，如果佢喺
Well, if we have some definition in later courses, we'll try to offer some explanation here to facilitate members' understanding. Well, of course, I understand Ms. Ken's point. Data is a general term. So we would specify in the schedule what healthcare data. And we have been talking about index data, which is a similar situation, and also healthcare data. There are definitions for these terms. So we think we don't need to have a separate definition for data or information. We just adopt their natural meaning. Dr. David Lam. Well, the definitions are rather complicated. Perhaps you can explain at one go a number of related terms. Relevant healthcare provider, specify healthcare provider, register healthcare provider, etc. I think if we can do that, we would have a clearer picture of the field. Well, it seems that we are going to discuss these terms in different courses. So I wonder if it's a good idea to go back and forth. Yeah, perhaps I'm saying that we should have some explanation offer for the related terms at the same time. So perhaps I can explain to members what different kinds of healthcare providers may be involved here. Yes, the different healthcare providers, because they enjoy different rights and privileges. For Hong Kong, we have registered healthcare provider. For this, you can go to section 19 and see a list, and you know who can be registered as a registered healthcare provider. And then we have specified healthcare provider. We are talking about Hong Kong healthcare provider here. In the original ordinance, there's no need for registration. For example, HA and Department of Health, they are not required to be registered, so they are specified healthcare provider, which means HA, D of H, and other registered healthcare providers. And then will be further specified healthcare providers later. Because there are organizations, public organizations which are not exactly HA or D of H. So they will all come under Hong Kong healthcare providers definition. And then we come to non-Hong Kong healthcare providers. We have recognized non-Hong Kong healthcare providers, which means that the commissioner can offer recognition to some non-Hong Kong healthcare providers. And then the fourth category is relevant healthcare providers, meaning all those that I have mentioned. Hong Kong healthcare providers, specified Hong Kong healthcare providers, non-Hong Kong healthcare providers, and also specified healthcare providers. The Secretary can ask specified healthcare providers to provide specified healthcare data to the e-health system. This is a narrower definition. So for some healthcare providers, they have to provide the required healthcare data. So this will be done by the Secretary in a schedule. Specified healthcare provider will not cover non-Hong Kong healthcare providers because the law has no extraterritorial effect. 4D, relevant healthcare providers cover all those. How about E? Well, we would say it's a specified, it's a prescribed healthcare providers. And also specify healthcare providers. I'm grateful to Dr. Lam for his suggestion. Maybe we can get a table from the government setting out the different kinds of healthcare provider and different kinds of data, so that when we have a discussion on relevant clauses, we'll have a easy guide to follow. Because I find it rather complicated to follow the explanation that you have just given. Yeah, so you are saying that the definition will come in later courses. Yes, indeed. But of course, if we can provide a table for easier understanding, we can do that. Because the definition is not located with other related terms. Because you find all these terms all over the place, it's very difficult to read. For example, for registered healthcare provider, and also we have a prescribed healthcare provider. Registered healthcare provider include government. As for prescribed healthcare provider, it means D of H and also HA. I hope we can have a chart or table to facilitate understanding. We need the definitions because they can mean very different things in other clauses. But of course, we can do what the members suggest to facilitate members' understanding. All right, 006. Relevant healthcare provider. It means that prescribed healthcare provider, i.e., D of H, HA, and Hong Kong the registered healthcare providers, and B, recognized non-Hong Kong healthcare provider. Next, Hong Kong health professional. The definition is A, a person specified in Part 2 of Schedule 1. They are registered healthcare professional, and also under the recognition scheme, the healthcare professionals registered. And B, a person specified in Part 3 of Schedule 1. In the schedule, you see a list, and these healthcare professionals must be providing service in a healthcare facility controlled or managed or controlled by A, the government, B, the hospital authority, or an HA subsidiary, and 2 is engaged by healthcare provider specified under Section 53A, and the commissioner can also recognize some healthcare providers registered with the government. Because for primary care system, there are different healthcare providers, and the service recipient would be using e-health when he or she is referred to a healthcare provider outside the government. So is that clear? Okay, let's continue. Next page, page 7, is related to clause 5, bracket 18, enforcement notice. Means a notice given under section 26R, bracket 1. The Secretary can ask specified healthcare providers to provide healthcare data, and here in relation to the enforcement action, an enforcement notice can be given. Next, advanced medical directive. We have an expanded definition here to cover advanced medical directive, and here's the definition. It means it has the meaning given by Section 2A of the Advanced Decision of Life-Sustaining Treatment Ordinance. If no suggestion, we can move on. Penalty notice is the notice given under Section 47B1. This is the result of an enforcement action, and we have a later clause to this, and also recognition. It means that recognition can be given to non-Hong Kong healthcare providers. And what in relation to a non-Hong Kong healthcare provider, recognition means the recognition of the healthcare provider as a healthcare provider for the e-health system under Section 28, bracket 1. And in relation to the non-Hong Kong information infrastructure, it means the recognition of the information infrastructure connection to the e-health system under Section 26E, bracket 1. And we will have a more detailed and elaborate explanation in the subsequent clause, 26A. A question about recognition. If you give recognition to non-Hong Kong healthcare provider or non-Hong Kong information infrastructure, will the general public understand what are covered? For example, can you have a website, dedicated website, to provide the information to the general public? Yes, you can find certain provisions later for non-Hong Kong healthcare service provider and non-Hong Kong information infrastructure. Will publish certain information for the information of the general public. It can be done through a website or through the e-health system. Because only when you know this, you can then give your sharing consent to the relevant party. There's a form for that. Yes, this is based on the current system for Hong Kong healthcare providers. And there's also an app. And they can also call the registration office to get the relevant information. Well, I haven't visited your current website. You cannot just give people notices. You should have a list available on the website. All right. Recognized non-Hong Kong public health record system. It means that the non-Hong Kong public health record system under Section 26E1 And that is recognition can be given to non-Hong Kong public healthcare system.
Next one is recognized non-Hong Kong healthcare provider. In a similar vein, it means a non-Hong Kong healthcare provider that is recognized as a healthcare provider for the e-health system under Section 26A bracket 1. We will elaborate later. Next is e-health system, where we have deleted the word system and substituted with e-health system. In the future, we will refer the electronic system with the word e-health system. It means the information infrastructure maintained under Section 5 with the name electronic health system. Next is HA subsidiary. Members may recall that we have talked about prescribed healthcare providers. They are controlled or managed by HA subsidiary. So we need to have a definition of HA subsidiary. It means a body corporate established by the Hospital Authority under Section 5 bracket N of the Hospital Authority Ordinance, Cap 113. Then we have completed the part of definition. Now we go to page 9 of the English version. 8 in the Chinese version is clause 6, which amends section 3, substitute decision maker. Let me give you some background information. What does it mean, substitute decision maker? In the realm of e-health system, there are minors or people who are mentally incapacitated. They are not able to take part in e-health system or give a consent. So this category, there is a category of substitute decision maker who makes a decision for children and those who are mentally incapacitated. Now there is this definition about who can become a substitute decision maker. There is no direct relevance in relation to substitute decision maker. Well, there is a change in relation to sharing consent. The current consent is that healthcare provider may have access to the information thereon. In the existing definition, there is a 1-year consent and an indefinite consent. Well, people have been choosing the indefinite consent option. The nature of the e-health system is a lifelong record, so we will remove the option of 1-year consent. This doesn't affect the choice of members of the public. If they have given a 1-year consent, or if they later decide not to give the consent to the healthcare provider, they only have to remove the sharing consent. We think the removal of the option of 1-year consent is appropriate. We will further explain when we go to the provisions of the removal of the option. In terms of substitute decision maker, we remove the reference of 1-year consent. Please turn to page 9 in the Chinese version, 10 in the English version. D. In relation to a definition of relevant time in subsection 5, paragraph D, E, or F. In paragraph 11, we remove E. That is page 12 of the English version. In relation to a sharing consent that is renewed under a certain section, the time at which the sharing consent is renewed. Since we are going to remove a 1-year consent, we remove E here. I'll pause here for members to digest what I've said. Ms. Carmen Khan. I understand what you said. What about advanced medical directives? Do we need to add or make reference in relation to the substitute decision maker by referring to the advanced medical directives? In relation to page 3, there is a reference of advanced medical direction under advanced healthcare directive, medical directive. I remember that there is a reference of decision maker, substitute decision maker. And there was a discussion in relation to advanced medical directive. We have added a certain type of substitute decision maker. So do we need to have a corresponding addition here? The meaning of substitute decision maker here is confined to decision makers to give or change consent in relation to registration or sharing or an access of data in e-healthcare system. Say, for example, a parent making a decision to register or grant access to a certain provider data in relation to the child. So decision maker here, the substitute decision maker, is only in relation to the consent to register and the consent to sharing data under the e-health system. So it doesn't cover a substitute decision maker in relation to revocation of advanced medical directives. No, it doesn't cover. When it comes to the access of information of e-health system, we don't think there is a need to differentiate substitute decision maker. There is also one part here, page 10 in the Chinese version. There is an amendment. It's page 11 in the English version. We will substitute system with e-health system to achieve consistency. We will continue. Part 2. We now turn to page 12. It's clause 7 to amend section 4 in relation to the Chinese term government. In the heading, we will add the word 特區 SAR before 政府 government. And in the provision, there is the same amendment. We have already had a discussion on this. Please continue. Page 13 in the Chinese version. The same in the English version. This is clause 8 in part in the blue bill. That is an amendment relating to part 2, the heading, Electronic Health Record Sharing System. We will delete the word record sharing. We've had a discussion. The name of the system will be changed to e-health system, hence the amendment. Clause 9. There is an amendment of the establishment of. We will substitute it with e-health. We will explain what is meant by e-health. We will continue. Clause 10 in the blue bill. An amendment to section 5, establishment of. We will substitute it with e-health. It is also a technical amendment. And then subsection 1 will be repealed. We'll substitute it with a new part. The addition under bracket 1 of section 5 is to explain what is eHealth because of the change in name. It says that it is the system on and after the commencement date, the information infrastructure established and maintained under the former Section 5 bracket 1 and known as Electronic Health Record Sharing System in English and 電子健康記錄互通系統 in Chinese immediately before the commencement date is to be known as Electronic Health System in English and 電子健康系統 in Chinese. So the Electronic Health Record Sharing System is the eHealth record in its new name. So this is an elaboration. Ms. Carmen Khan? That means in the future it's called electronic health system or eHealth system. Is the electronic health system. In short, it's eHealth system. The full name is electronic health system. So in the heading and the provisions, you use eHealth for short. When it comes to publicity efforts in the future, it's called an electronic health system. So how will you call it? Let me elaborate. Electronic health system, 電子健康系統 is the official name. 醫健通系統 eHealth system is a name commonly known since its launch 10 years ago. So we specify that the electronic health system is called eHealth in short. The name eHealth is given a legal status. When we refer to the electronic health system, we call it eHealth for ease of reference. But this is to make it easier to understand. So in the future, is there still the word record sharing? Because this is called the Electronic Health Record Sharing System Amendment Bill. What is the name of the ordinance? The ordinance in the future will call Electronic Health System Ordinance, and it is eHealth for short. In the old ordinance, we use the word record sharing system, EHRSS for short. So after the amendment, the old name will no longer exist. Well, this is the reason why we have many references to delete the word system with eHealth system. Please continue, Erica. Now we move on to bracket 1A. This is still an explanation of what is the eHealth system. So this talks about the purpose of maintenance of the system by Commissioner. It is A, keeping the record required, and B, sharing and using the data and information contained in those records, and C, providing support in connection with or facilitating 1, the provision of healthcare to registered healthcare recipients, and 2, health management by registered healthcare recipients. A and B are there. We have added healthcare functions. In the past, the system's positioning was sharing system for healthcare providers. In the future, it becomes a comprehensive and integrated information infrastructure. There are additional functions. You can use the e-health system to manage your healthcare plans and health management. So we have added Part C, referring to service provisions. This is more complete to explain about the purpose of the e-health system.
Let's continue. If there's no other question, we now move on to 5(2) with a repeal system and substitute this by e-health system. And then there's a definition here on commencement date and on former section 5(1). Commencement date means the day on which section 10 of the Amendment Ordinance 2025 Amendment Ordinance comes into operation. Former section 5(1) means section 5(1) as in force immediately before the commencement date. If members have no further question, we can move on to page 14 of the Chinese version. This is about Clause 11, amending Section 7, giving of joining consent. This is about the consent to be given. If a citizen wants to be registered as a healthcare recipient, he has to obtain from the relevant healthcare provider any shareable data of the recipient. So as soon as a healthcare recipient register under eHealth, then the healthcare service provider can have access to the sharing of data, but he can specify which healthcare provider can have access to his healthcare data. So we have two consents, joining consent and sharing consent. Section 7 would be about joining consent. So here's the specified details to be amended. The consent is to, after the registration of healthcare recipient, allow the commissioner to obtain from relevant healthcare provider any shareable data of the recipient. Relevant healthcare provider means a specified Hong Kong's healthcare provider and specified non-Hong Kong healthcare provider. And two, to obtain from a specified healthcare provider any specified health data of the recipient, so the commissioner can obtain the data of the recipient when the consent is given. And three, to provide to a relevant healthcare provider to which the recipient has given a sharing consent any shareable data of the recipient. So if the recipient has given a sharing consent, the commissioner is then authorized to have access to the recipient's healthcare data. And also, if a specified healthcare provider has made a healthcare referral to another prescribed healthcare provider to provide, then the commissioner can provide to that other prescribed healthcare provider any shareable data of the recipient relevant to the healthcare referral. Here we have this term prescribed healthcare provider, meaning healthcare providers in Hong Kong. So referrals, the referral system only applies to Hong Kong healthcare providers. Mr. Orin Kong, this is an important provision. When a patient joins the scheme, he has to know what is meant by the joining consent under 3(2). a prescribed healthcare provider can provide certain specified health data. You have a schedule for that, but at this point, this is blank. And also A4, free A4 referral. If I'm a participant, if I have many shareable data under the system, when the doctor refers me to, say, to an optometrist, does it mean that the optometrist can see all the shareable data of mine, not just the specified data of the referring doctor? The secretary is authorized to prescribe certain healthcare providers to provide certain healthcare data for the system. So what is meant by a prescribed healthcare provider and prescribed healthcare data, that this will be dealt with in the schedule. The schedule at present is left blank. We hope through the amendment bill, and also we would collaborate with the healthcare sector to promote the use of e-health system. And the healthcare provider would would provide the data of the service recipient to the system. And this power will only be exercised if, after a few years of operation of the new e-health system, not many healthcare recipients are benefited by the sharing of data. So we have to have further discussion on what is meant by the prescribed healthcare providers. The healthcare data in the course of treatment or healthcare provision are very important. For example, lab report results, imaging services report, and people may want to make comparisons. So we may prescribe such services as prescribed healthcare providers. But there will be further consultation with the healthcare sector before we do the prescription part. Secondly, Ms. Kwong asks if a referral is made, is the healthcare provider referred to can have access to all the shareable data? We have specified here that to provide to that other prescribed healthcare provider any shareable data of the recipient relevant to the healthcare referral. That is to say, only data relevant to the healthcare referral can be accessed. Chairman? All right. In the English version, relevant to the healthcare referral. I've seen that. Thank you. If there's no further question, we can move on to 3B. We were talking about healthcare providers. But under the amendment bill, the Commissioner may recognize Hong Kong public health system and also non-Hong Kong ones. So perhaps, and in the future, the Commissioner may also recognize non-Hong Kong public health record system. And when a Hong Kong person receives service from those non-Hong Kong service providers, then we need to have a system that is linked. So the commissioner allows the commissioner to obtain from a recognized non-Hong Kong public healthcare system any shareable data of the recipient, and also to provide to a recognized non-Hong Kong public healthcare system in relation to which the recipient has given a sharing consent any shareable data of the recipient. That is only after sharing consent is given.
好，如果冇就去15頁。
委員冇問題嘅話咧，我哋可以再睇落去啦。咁咧
Let's move on. Page 15. The consent can also be about the provision to a relevant healthcare provider any shareable data of the recipient in the form or manner specified by the commissioner. So similarly, this is about the subject we just discussed, and that is for non-Hong Kong public healthcare record system, which is recognized by the commissioner, and then the access will be provided, and also the data can be provided in the form or manner specified by the commissioner. And there's another amendment under bracket 5. We will repeal the word system and substitute with e-health system. We can now go to page 16. It's clause 12 of the Blue Bill. Registration of healthcare recipient by commissioner. 8 bracket 2, we will repeal system and substitute with e-health system. Page 17, technical amendments here. 9 bracket 1, heading, withdrawal of healthcare recipients registration, repeal system and substitute with e-health system in subsection 1, technical amendment. Now we are on page 18. It's clause 14, amending section 10, suspension of healthcare recipients registration. Some background information here. After a Hong Kong citizen has registered with the e-health system, if certain conditions or provisions of the system are violated, the commissioner can suspend the registration. So we have a condition here on the contraventions. If the healthcare recipient contravenes a provision of a code of practice issued under section 52. Because the citizen's role is getting more important under the new system, there will be the need to formulate certain code of practice. And if the healthcare recipient, that is the registered Hong Kong healthcare recipient, contravenes the code of practice, the commissioner may suspend the registration. And also for D, we repeal system and substitute with e-health system. All right, we can now move on to page 19. Is there an amendment of the punctuation mark? 11C? Yes, the punctuation mark will be repealed. It's a textual amendment. Page 19.
Page 19, bracket 4, in relation to the impact when there is a suspension of registration. It says that relevant healthcare provider or specified healthcare provider can still provide information to the info system. However, the recipients will not be able to access such information in the system. And the information cannot be provided to a recognized non-Hong Kong public health record system. In the existing ordinance, there is the healthcare provider. Now, the more are included, so we have changed the reference to relevant healthcare provider or specified healthcare provider or recognized non-Hong Kong public health record system. What if a recipient withdraws from the system? The data in the system will continue to exist. Well, if the recipient exits from the system, there is a procedure to delete all records. We will de-identify the data because the information is important. The unidentifiable data can be used for research purpose. So information relating to the identity of the data subject will be deleted, but the information remains, yes. But what if someone passes away? Does it mean that the data will be deleted? Yes, it's done in a similar way. There is a rule stating that after a certain period of time, upon the passing of someone, the information will be changed to make it unidentifiable. Ms. Chan Ho-yen. Well, if I decide to withdraw from the system, you keep this data for research or reference purpose. And after a while, if I want to rejoin the system, does it mean that there will be a void? After I have rejoined, the information before I exited will stay? Well, there won't be a void. When the person rejoins, it's start from scratch. At the time when the person leaves the system, the account is deleted. It is quite difficult when the person rejoins to link up the previously deleted account. As a result, when the person rejoins the system, it will be a newly created account with a system being uploaded from then on. In the hospital authority, the record is still there. So the record in the public healthcare system will be uploaded automatically. But it's not the case when it comes to the private sector data. Then you will have to make it clear to the public that if you decide for any reason to leave the system, then the data will become incomplete or lost. There may be far-reaching implications in the future. You have to make it very clear to the public. You said that the data is kept for research purpose. For whom? Well, we talk about different uses of different data. One of the uses is for research purpose. So the person might have passed away or exited the system. We will de-identify the data because the data will still be of other users. The data will still be included if it's used in a research. Let me give you an example. If I withdraw the system, before I exit, I can print my own record. 3 years later, I rejoin. Can I ask for the previous information that I have downloaded to be uploaded back into my account? I think there will be technical difficulties. The uploading of data is done with care. It will be done by a doctor or a healthcare provider in a form and manner prescribed. This is done via the interconnectivity of different systems. But if you want to upload a PDF file into the system, well, strictly speaking, that is allowed. You can upload the PDF into my personal file, but the structure and format will not be ideal. The information may not be aligned. Say, if it is a vaccination record, it won't go under the category of vaccination record. So it's yes and no to your question. That may be the case today. In the future, well, technology may enable this differentiation of data. Dr. Lam, supplementary question? Yes. Well, I'm a patient. I exceed the system. The data in the system remains, but it is de-identified. Certain periods of time has lapsed, and I want to rejoin. The data in the public healthcare system will be uploaded. So there will be two sets of data. One that is identifiable because it's in the public healthcare record system. The other one, de-identified, but they are of the same person. It will affect the accuracy of data analysis. Yes, you're right. Well, we'll have to let the public know that joining the system will keep your healthcare record complete. Leaving and rejoining will have a huge impact. So if once you joined, then it should be a lifelong consent. We don't think there will be a huge impact on the accuracy of the data, even people leave and rejoin the system. Ms. Chen Ho-Yan. Someone may leave the system and then rejoin. Well, it's just like blood donation. Some people play the system and disrupt it. So if there are people leaving and rejoining, are there any way to handle these people? Would there be a maximum? Will there be a limit? Well, someone may leave and rejoin the system every month, every year. From what I heard, that the data will be all scrambled. I'm not talking about a hacker taking the system. It's someone who willfully and deliberately disrupts the system, thereby harming the integrity of the system. It may not be a large group of people. Are there ways to stop people from doing it? Well, I think it will, first of all, not be good for that individual. Well, the information is entered by healthcare provider. But it says that, well, if I leave the system, then the data remains without identity. But then if I rejoin, then the same set of data will be duplicated. Well, if someone leaves and joins the system 30 times a month, we will be able to identify the person because you need to have your identity document to make a registration. We will stop that person from doing so administratively. If someone deliberately undermines the system, the commissioner may take action. Say, for example, if someone sends a virus into the system or uploads a picture of a cat or someone else onto the system, then we can take action by deleting the account. We will bear this in mind to see if there are many people doing such things before we decide on putting in place administrative measures. What if someone who leaves and joins the system 3 times? So it will harm the person's own record. Well, will it affect the integrity of the data? Well, if you rejoin the system, you will not have access to data that has already been deleted. It's not good for that person. Well, this is an extreme case. A normal person will not do it. But I think that we need to have some administrative sanction. If you just say that, well, then you'll be excluded from the system, then there is not enough deterrence. So are there other ways to penalize such behavior? Of course, we want everyone to be normal, but you'll never know what will happen. Well, if someone deliberately exits and rejoins the system, it will affect the person's record, it will affect the healthcare provider, as well as the big data. We will keep in view the situation. If there is a large number of cases of abuse, then we will consider administrative measures. Let's continue. Page 20. Is clause 15 to amend section 11, cancellation of healthcare recipients registration. There are technical amendments and additions. The principle is the same as the previous section. Under certain circumstances, the commissioner may cancel the recipient's registration. Say, for example, there is a contravention of the law or conditions. So under section 11 bracket C, we've added 1A. That is a provision of a code of practice issued under section 52. That means if a healthcare recipient contravenes a provision in the Code of Practice, if it is a serious case, the Commissioner has the power to cancel the registration. There are also some technical amendments as well. Under 11(1) C1, we have deleted the word or, and in D, we have replaced system with e-health system. It's the same as what we've done before.
如果
If members have no questions to raise, we can move on to page 22. We have no amendment for page 21. It's clause 16 of the Blue Bill, amending section 12, giving of sharing consent. A number of provisions related to giving of consent or sharing consent here. And they have to do with the simplified sharing consent system. When a person has joined the e-health system, he can give consent for the storage of his healthcare data, and if he wants a healthcare provider to have access, he can give a sharing consent. And that's why we need these amendments. Let's go over the amendments one by one. First, 12(1). It explains the meaning of sharing consent. Sharing consent means A, a consent specified in subsection 6 to a relevant healthcare provider that provides healthcare to the healthcare recipient. And here, healthcare provider includes Hong Kong and non-Hong Kong healthcare providers. And B, it means a consent specified subsection 6, capital A, in relation to a recognized non-Hong Kong public health record system, a non-Hong Kong system which is similar to our e-health system, that is. And 12(6), the original bracket subsection 6 is repealed because the original subsection is about prescribed healthcare providers. And here, this is an expanded provision. The relevant healthcare provider means for the purposes of subsection 1A, the consent is to allow the relevant healthcare provider to obtain from the e-health system any shareable data of the healthcare recipient in a form or manner specified by the Commissioner, and if the relevant healthcare provider is a prescribed healthcare provider to provide to a referral healthcare provider any shareable data of the healthcare recipient relevant to the healthcare referral and in the form or manner specified by the Commissioner. So this is in the case of a referral made. And B, a referral healthcare provider can obtain from the e-health system any shareable data of the healthcare recipient relevant to the healthcare referral and in the form and manner specified by the Commissioner. If there's no further question, we can now turn to page 23, 6 capital A. For the purposes of subsection 1(1)(b), the consent is to allow any shareable data of the healthcare recipient kept in the e-health system to be provided to a recognized non-Hong Kong public healthcare system in the form or manner specified by the Commissioner. Please pause. Ms. Carmen Khan. It's a question about page 22A. Why do you only talk about the relevant healthcare provider? Well, the relevant healthcare provider can either be a Hong Kong or non-Hong Kong healthcare provider. If a healthcare recipient gives a sharing consent, then the relevant healthcare provider can have access to the shareable data. Well, I'm all in favor of having a table. Adopting a purposive approach to tell us which are the relevant healthcare providers, and then by giving a sharing consent, access to the shareable data can be made. You want to have a simplified provision, so you use the term relevant healthcare provider to cover both Hong Kong and non-Hong Kong healthcare provider. I think you want to have a wider definition. That's why you have prescribed, specified, relevant healthcare provider. Well, we'll try to find something more easy to read so as not to confuse members. All right, we can now move on to, we're still on page 23. Subsection A is repealed. A sharing consent may be given for an indefinite term or a 1-year term. We're going to take away the 1-year term option. That's why we don't need this subsection anymore. If members have no questions, we can now turn to page 24. We are going to repeal this section 13, indefinite sharing consent. It's course 13. Because the 1-year term is repealed, so we would substitute with term of sharing consent, which means the sharing consent is in effect until the healthcare recipient's registration is withdrawn from the e-health system, that is a withdrawal by the healthcare recipient, or B, the healthcare recipient's registration is cancelled because the healthcare recipient has contravened certain provisions or the code of practice. And then C, the consent is revoked under section 15(1). Ms. Carmen Can, I think my question has been answered. So it's in force. The consent is in effect until one of the 3 things happen under section 13. All right, page 25 now. It says clause 18, the blue bill, section 14, the repealed. This is about the 1-year sharing consent, and this is no longer required because the option is removed. Page 26, section 15, revocation of sharing consent. First of all, section 15(1). The original version reads prescribed healthcare provider, and now since more healthcare provider will be included in the e-health system, so we would be referring to a relevant healthcare provider or in relation to a recognized non-Hong Kong public health record system. And then 15(7), a technical amendment. We are going to repeal system, substitute by e-health system. If members have no questions to raise, then page 27 now is clause 20 of the blue bill, amending section 16, sharing consent taken to be given. A number of amendments here. So here's some background information here on sharing consent taken to be given. Under the original ordinance, if a healthcare recipient has joined the e-health system, it would be taken to have given a sharing consent to the Department of Health and the HA. Because D of H and Health HA are public sectors, healthcare provider, an important safety net for public health. So at that point, we specify that sharing consent is important when it comes to D of H and HA. So it's a presumed consent given for the two organizations. And now here we're going to have a amendment, because apart from the D of H and the HA, there are other organizations which may not be providing direct service to the healthcare recipient. So we are going to specify the different entities. For example, HA subsidiary and other healthcare organizations operated by HA. For example, the new Chinese Medicine Hospital and other public sector hospitals. So first of all, 16(1), we are going to delete the Department of Health and HA and substitute with each specified entity. And for 16(2), we delete the Department of Health and to the HA. And then bracket 4, a consequential amendment. Because we don't have a section 12 bracket 8 and section 13 and 14, so we need to make these consequential amendments, and we have a newly added subsection 5 on specified entity, which means that the Department of Health, the HA, the Primary Healthcare Commission, or a facility managed or controlled by the government, the HA, and the or HA subsidiary. Well, we have to conclude by 10:30. So I allowed Mr. Houghton Chow to ask his questions now. You have explained that an HA subsidiary, I thought many entities are under HA subsidiary, but you are going to have the Chinese Medicine Hospitals and other organizations, other entities. So what are they? Can you tell us what other entities might be involved apart from the new hospitals? For example, in the 18 districts, we have the Chinese Medicine Clinic, which is controlled and managed by HA subsidiary. As Mr. Chow has pointed out, we want to maintain flexibility here. The HA can actually set up different subsidiaries to facilitate future management and operation. So we want to maintain certain flexibility to cover these entities operated by HA subsidiaries. So conceptually, legally speaking, they are separate entities. All right? I'm sorry. Maybe Ms. Khan, you can raise your follow-up question at the next meeting. I have to conclude the meeting here. We are on page 27. We'll inform members of the meeting date and time of the next meeting. Thank you.